1,000 times per year. So that's quite a lot. It's performed on a general anesthesia and mostly by plastic surgeons, but there are also some ENT doctors who perform this procedure. There are some risks to this procedure. You can have an infection, there can be a bleeding, you can have hypertrophic scars, and there can be some wound problems. And especially if you see the hypertrophic scar, that's a huge problem. And I think most of the plastic surgeons have seen it happen after ear surgery. Then are the results good? Yes, most of the times the results are very good of the surgery. But if you have complications, then the results can be less beautiful. Some of these are quite extreme, but it can happen. Is there an alternative? Yes, there is, of course, and that is what we are talking about today. In 2017, I did the ASAPS International Fellowship, and I went to Dallas. And in Dallas, I met Dr. Bird. And Dr. Bird is a plastic surgeon and a very nice and innovative man, and he invented EarWell. And EarWell is a non-invasive device to correct ear deformities in babies without surgery. And as you can see on the picture, it works like this. You place a cradle around the ear, and then you add some retractors and formers. You cover it up with a lid, and after a week or two, the ears are shaped in a better form. So then there are a lot of advantages to this technique. It has no scars, there is no pain, it is no surgery, there's no anesthesia, there's no more bullying, and it has no consequences on emotional development. So that is why I thought, oh, why is nobody doing this in the Netherlands? So I should start doing this because it's so much better than surgery. But the road to doing EarWell in the Netherlands for me was kind of bumpy because I had to import the product into the Netherlands. Then I had to do marketing to get a new non-invasive treatment to get it more known with people, with parents, with pediatricians and midwives. And then I had to deal with the babies. That was very good, but you also have to deal with the parents. And at this moment in my journey is going very well. We treat in our clinic, we treat 1 to 2 new babies per week. And the parents are mostly very happy with the results. And I have another enthusiastic plastic surgeon who's also here today at the webinar, who also started EarWell and is also very happy with this new treatment. So now I'm at one point that I think more babies should be treated, because it's a very large group of babies that have an ear deformity, and I wanted to treat more babies. And that was exactly when I met Bart de Poter from Aleamed. And as you can see on the picture on the left, he also has his own experience with an ear deformity. He had protruding ears as a baby or as a child, and they were surgically corrected. So his are no longer there. And on the right side, there are mine. They are still there. So we both have experience with an ear deformity, and we decided to team up to inform more parents about this new treatment and to train a selected group of plastic surgeons to perform EarWell as well. So this is the first webinar. So I'm very happy that you guys are here. This is something you probably all know, the normal anatomy of the ear. And what's important is the helix, the antihelix, and the concha. That are the parts of the ear where most deformities form. There are a lot of different deformities, and there also are a lot of babies born with a deformity. In literature, it can vary a bit, but it's around 15 to 30% of the babies that are born with an ear deformity. And that means in Holland alone, it's 25,000 babies. So that's a lot. But 30% correct self within the first week. So they are born with an ear deformity, and then within the first week, the deformity corrects without treatment. But the other 70% worsens. So if there is no improvement in the first week, parents should consider EarWell to treat the deformity. Then the different kind of deformities you can treat with EarWell. Protruding ears, yeah, everybody knows this because it's the most common deformity. What's the problem with protruding ears? They look kind of cute in babies. What I tell parents is that the baby ears need to be stuck to the head. They cannot stick out more than 7 millimeters. So that's so you need to look at the ears very carefully. And there's something midwives and pediatricians in your hospital or in your region can do for you, and they can refer the parents to you for treatment. And there's another thing Dr. Bird invented, which is very useful. It's called a projectometer, and it's a small pen, and it has 3 colors: green, yellow, and red. You can put it behind the baby's ear, and you can see if the baby needs treatment. Because protruding ears triple as the ear grows, so it becomes more and more and more in the first year. But if you use this pen, this measurement instrument, then you can see if a baby needs treatment. So that is very useful, and it can also be very useful in convincing parents that treatment is necessary, because sometimes parents doubt a bit, but should I do this to my baby? And then you can convince them that it's necessary because the ears are too far away from the head. And with the projectometer, you can decide, is there an indication for EarWell? Then lidding, it's also a very common deformity. On the left side, you can see it's very mild. So the upper part of the ear is a bit collapsed, and it covers a bit of the upper part of the ear, so you don't see the superior cross. It can be very mild, but it can also be more severe, where 1/3 of the ear is covered with skin. Helical rim deformity, it's a deformity in the helical rim. It's mostly, the cause is mostly compression in the uterus. A Stahl's ear, everybody knows this as well. I think this also looks very cute in babies, but it will look like a very pointy elf-like ear in adults. And it can also surgically be very difficult to correct and properly, but with EarWell, it's much easier. Then a conchal cross, it's an extra piece of cartilage within the concha, and it can also cause a protruding ear in the future because it pushes the concha outward instead of inwards. A lot of deformities, ear deformities, are mixed. So you have some lidding combined with the conchal cross, and with EarWell you can correct it. You correct the whole ear. It's not just one deformity, but you correct the whole ear. And then a constricted ear, this is not a deformity; it's a malformation. So that means that not all the cartilage and all the skin is formed. There are parts missing. You can also correct it a little bit with EarWell, but it will never be a normal shaped ear. But if it needs surgical correction in the future, you can improve the shape already a bit with EarWell, and it makes the surgical correction easier in the future. So it doesn't make the ear look perfect, but at least a little bit better. Then cryptotia, and cryptotia is very rare in the Caucasian population. It's where the upper part of the ear is buried under the skin. I've never seen it myself, but also this can be corrected with EarWell. How are the results after EarWell? And to be honest, I was very impressed in Dallas as well. And when I started here, I was still very impressed with the results because they are good. And it's very nice also to see after 2 weeks that the parents, they see the results, they see the difference, and then they know why they are doing this treatment to their child. So I will just show you a lot of pictures of different results. So this is a helical rim deformity. This is lidding, a protruding ear, another protruding ear, mixed deformity, conchoid cross. You can see some redness of the skin. I took this picture myself, and just after removal of the EarWell, and then the skin is still a bit red, but that will go away in 2 days. A Stahl's ear and cryptotia. Again, the advantages of EarWell are there are no scars, there's no pain, no anesthesia necessary, and there are no serious complications. And because it's performed so early in life in babies, there is less bullying, there are less social problems, and a higher level of physical activity. Then the cost, it will cost the parents something, because in Holland it's not covered by insurance. So the costs are 1,500 euro for a bilateral ear and 1,200 euros for a unilateral ear. And the cost for the clinic, so if you need the supplies to apply EarWell, and one large kit is around 500 euros. And with one large kit, you can treat a bilateral ear deformity for 6 weeks. Okay, maybe Koen. But
okay. Yeah. Nee. Okay, that's cool.
Okay, so with one large kit, you can treat a bilateral ear deformity for 6 weeks. That means if you have a unilateral ear deformity, then you have some left from the kit, and you can use it on another baby. So that can be financially attractive for the clinic. And also, if you treat a baby for 4 weeks, then you also have some leftovers and can use it again. What I will show you now is an EarWell training video. It's the basic video. There is a website, and you will get a password if you want to start EarWell, and you can watch a dozen videos of all the different deformities, and you can watch it yourself, and also what you should do with different deformities. This is just the basic video. It will take around 16 minutes. First they will show you what is in the kit, and afterward how to apply this system. Oh, I just wanted to ask, does everybody, because I cannot see that, does everybody hear also the text? I don't know.
No. Nee, kunnen niet horen.
Nee? Oh, dan ga ik dat anders doen. Wacht, dan doe ik heel even mijn... Oké, wait. I will put the volume of the computer on. One moment. Ik moet alleen eventjes...
Control formers.
Oké.
Control former.
Kunnen jullie het nu wel horen?
Ik kan het horen. Ik weet niet de rest.
Oké, top. Ik ga hem even wat harder zetten.
Alcohol wipes, acetone alcohol pads, EarWell forceps, hair trimmer with battery, micropore tape, retainer tape, instructions for use, training video, parent instructions for use and care, and ear prosthetic. The ear prosthetic is supplied to allow new EarWell providers a tool on which to practice applying the components while viewing the training video in advance of a first procedure. If you opt to use the prosthetic, we recommend applying a small amount of lotion to the dry silicone prosthetic base to permit ease of posterior cradle movement. Please note that all EarWell components, other than the trimmer and forceps, are intended for single patient use. No EarWell component, other than the trimmer and forceps, should ever be reused on a new or returning patient. Section 3, Procedure. There are 6 basic steps to apply the EarWell. 1. Trim the hair around the ear. Use the battery-operated trimmer included with your kit to cut the hair around the infant's ear. Lay the blade parallel to the skin and move through the hair as you would a comb. Cut to about 2 centimeters beyond the perimeter of the posterior cradle. Be thorough in trimming, since successful adhesion of the cradle to the skin is predicated on a smooth surface to which the posterior cradle is applied. Use the adhesive side of paper tape to remove any loose hair from the skin surface before proceeding. The trimmer can periodically jam. Separate the two blades by sliding the locking mechanism down, removing the detachable blade, cleaning each, and reattaching and relocking. 2. Prep the skin with alcohol. Use the provided alcohol wipes to clean the area. Generally, 2 packets of wipes per ear will do the job. You may notice that some infants will cry because of the cold, wet alcohol. Permit the alcohol to dry thoroughly for a minimum of 30 seconds before proceeding. 3. Apply the posterior cradle. The posterior cradle can be thought of as the foundation to which all of the other components of the EarWell system attach. Therefore, positioning the cradle is the most crucial step. Before applying the posterior cradle to the baby's ear, first separately remove and then replace each of the tabbed paper release liners from the bottom of the cradle. This will simplify their removal when the cradle is on the child's ear. Pull the ear through the cradle and set the cradle against the skull. You may wish to use a cotton applicator to help manipulate the ear through the posterior cradle. After the ear is passed through the posterior cradle and the cradle sits on the skull, lift the ear and make sure that the posterior conformer on the posterior cradle rests near the retroauricular sulcus of the infant's ear. The retroauricular sulcus is the fold or crease where the skin reflects away from the skull onto the back surface of the ear. Proper positioning is fundamental to a successful result, and also probably the most challenging aspect of the procedure. The posterior conformer, as mentioned, resides behind the upper third of the ear, slightly below the helical rim and 1 to 2 millimeters outside the retroauricular sulcus or the sulcus. It should be oriented so that it is in line and parallel to the upper third of the sulcus. It is important to reemphasize that the posterior conformer should not touch the sulcus and to allow 1 to 2 millimeters for growth. Before proceeding, check to make sure that the ear rests comfortably within the inner perimeter of the cradle. Also, allow some room for 2 weeks of ear growth. If the ear overlaps or aggressively presses against the vertical wall, remove the medium cradle and select a large cradle for the application. Once the posterior cradle is correctly positioned and properly sized, remove the paper release liner that is covering the adhesive on the bottom of the cradle. The liner is split into 2 pieces with individual release tabs for easier removal. Many physicians like to remove the liner that sits in front of the ear first and then proceed to remove the liner that sits behind the ear. It doesn't matter which order you follow. Prior to removing the paper release liners, lift any untrimmed hair from beneath the adhesive. After the liners are removed, make sure that the posterior cradle is fixed securely. Use your fingers to press all parts of the cradle, including the adhesive footing. 4. Apply the retractor. The retractor is a versatile component that permits a standardized procedural protocol with consistent positive outcomes. There are 3 sizes of retractors provided: large, medium, and mini. Typically, the large retractor is used with a large cradle, and the medium retractor is used with the medium cradle. The mini retractors furnish supplemental help in forming the helical rim and scapha. A mini retractor should only be used in conjunction with a medium or large retractor when additional forces are needed to shape the ear. For example, when there is severe lidding or profound helical rim irregularities. Use a retractor or combination of retractors that most closely match the size of the helical rim of the infant's ear. Begin by shaping the medium or large retractor, which contains an aluminum insert. This allows them to be contoured toward the desired slope of the ear. Using your fingers, bend the medium or large retractor so that it approximates the desired shape of the helical rim. Position the retractor so that it does not overlap the posterior conformer that is residing below the ear. This is a crucial step since ear compression between the retractor and the posterior conformer can result in unwanted and potentially damaging pressure. You can lift the ear to visually confirm that the retractor does not overlap the posterior conformer. Once the retractor is in proper position, glide the helical rim into the groove of the retractor, making sure that the retractor cups the rim. Finally, remove the liners on the inside of the posterior cradle to expose the adhesive and attach the retractor to the posterior cradle. Note that there are two adhesive strips, one horizontal and one vertical. Press the retractor so that it will adhere to the adhesive securely. The sole purpose of both the vertical and horizontal anterior adhesives is to hold the retractors in the proper position until the attachment of the anterior shell. Since many ears are not wide enough to reach the perimeter, it is not necessary that the retractor actually touch the adhesive on the vertical cradle wall. If it becomes necessary to place a retractor or a combination of retractors at the top or near the top of the ear, there may be too little available space for comfortable positioning. Their placement could also introduce the possibility of the retractors overlapping the posterior conformer below the ear. Increased space at the top of the ear can be achieved by snipping 2 millimeters from the top of the posterior conformer using a sharp scissor. This simultaneously reduces the possibility of overlap of the posterior conformer. However, it is important to visually reaffirm that the position of the retractor in relation to the posterior conformer confirms that there will not be any overlap from above. Care should be taken to avoid cutting through the bottom support when trimming the posterior conformer. 5. Insert the conchal former. Now you're ready to place the conchal former over the concha. The conchal former exerts downward forces to deepen and expand the conchal bowl, decrease the height of the vertical conchal wall, and to decrease the conchal mastoid angle. These therapeutic actions are instrumental in contributing to the correction of prominent and cup ear and directly correct the conchal cruise. Since its insertion benefits the correction of most ear deformities, it is recommended that a conchal former be inserted with each new procedure. It should be noted that the conchal former may result in tissue irritation on the concha. If abrasion is observed during a removal and reapplication, it is easily resolved by delaying the insertion of a new conchal former until the following application or when healing is apparent. Informing parents of this possibility in advance of the procedure will go a long way to minimizing their concern if any irritation is revealed at any point during therapy. Proper positioning of the conchal former is necessary to a successful outcome. The open end of the horseshoe-shaped vertical base should face forward so the auditory canal is not obstructed. The legs of the horseshoe should straddle the concha when possible. The upper leg should reside against the upper vertical wall of the concha and below the inferior limb of the triangular fossa. The lower leg should reside against the inferior vertical wall of the concha. Note that the conchal former should exert vertical downward pressure onto the concha when the anterior cradle is applied and snapped into the posterior cradle. Typically, during the initial application, the conchal former exerts sufficient pressure solely from the attachment of the anterior cradle. Subsequent reapplications may, however, require an attachment of the supplemental conchal foam to raise the height to continue exerting downward pressure. Attach a piece of the provided foam to the top of the conchal former by removing the paper release liner and pressing the foam adhesive against the top of the conchal former. This will increase the height of the conchal former, allowing the anterior cradle to now exert the necessary downward pressure when it is attached. If undecided about the necessity of adding foam, lay a long wooden cotton applicator or tongue depressor across the top of the inserted conchal former. If the applicator can touch, or if it is within 1 to 2 millimeters of the top of both walls of the posterior shell, then foam should be added to assure continued downward pressure. If, in your estimation, the attached conchal foam resides too high above the posterior cradle vertical wall, it is acceptable to horizontally cut the foam to reduce its height. 6. Applying the anterior cradle. The anterior cradle will hold all the applied components in position, as well as apply downward pressure on the conchal former. It will also help to maintain the ear's position throughout the treatment regimen. You will notice that there are male tabs on the anterior cradle and female slots on the posterior cradle. Orient the anterior cradle over the posterior cradle so that the male and female parts align. Then merely insert the male tabs of the anterior cradle into the female slots of the posterior cradle. Physicians usually like to engage the tabs in the front of the ear and gradually work around to the back of the ear. After attaching the anterior cradle to the posterior cradle, once again make sure that there is contact between the conchal former and the anterior cradle. As noted earlier, the anterior cradle should lightly push the conchal former downward into the conchal bowl. If there is no evidence of pressure, remove the anterior cradle, add foam to the conchal former, and replace the anterior cradle. Once the anterior cradle of the EarWell is applied, inspect the ear to be certain that there is no blanching. Blanching means that there is too much pressure on a portion of the ear. You can easily spot this because there will be whitening of the ear. In order to relieve the pressure, simply raise the anterior cradle slightly. Section 4, Post-Application. Parents should be given the provided parent instructions for use and care, as well as a roll of the micropore tape. They also should be instructed to examine the cradle daily for any separation that may occur between the adhesive and the skull. Typically, the adhesive bond lasts 14 days. So when the adhesive begins to separate from the skin, parents should apply some tape and call you for an appointment for the next application. Usually 3 applications are necessary.
Okay, so that was the video. In the video, they applied micropore tape. What I do, and that's what I would recommend to you, is if you have the cradle, you see the attachments. It's attached on the child's head, and I fixate it along the whole cradle, because it will stay on better for 2 weeks. And I instruct parents to, I give them some tape and then instruct them to fixate it if there is a problem with. Then I wanted to show you one more video, because all of the videos of the different deformities are on the EarWell's MD website, so you can review them for yourself, but this one is not. And it's about conchal cross and detect silicone. It's also quite an interesting video, because the conchal cross can sometimes be difficult to treat. And you can add a little detect silicone to give just a little bit more pressure. And it's not just good for the conchal cross, but also for the helical rim. If there is severe lidding and if you put the retractor there, then you will get a pressure sore. So you can use some detect silicone to prevent a pressure sore. And that is what this video will show you.
So we're going to put this here as a base, get all the way back on the lateral wall. We're not going down into the ear canal. We're keeping it out of there, but we're keeping it in the conchal bowl. See how that nicely molds in there. And then we're going to be able to fit the conformer, or fit the former on top of that, so we can create that downward pressure to help eradicate that conchal cruise. So it fits in there very nice, like that's already starting to set up. And we'll take another piece, and we're just gonna make kind of a small prosthesis that's gonna fit inside the helical rim. I'm just gonna lightly lift that from underneath. Very difficult to treat this area without causing undue pressure. So by putting the prosthesis in here, we can supplement the retractors with the EarWell. So you get that lift underneath, You're not causing any undue pressure here because we've got the posterior former underneath. So that's starting to set up a little bit. I'm going to just kind of bring that around a little bit. This is nicely set. So we can put that retractor in place. So that's well seated. And then put our anterior cradle right here.
And that's it. So that can be in addition to your treatment of a bit more difficult ear deformities. Then how many times do the babies come back to your clinic? So what I do is they visit the clinic for the first time, then they will get instruction and first application. I've never had parents coming to the clinic and decided not to go for EarWell. So then we apply the first system. That will take you roughly 30 minutes. Then the second visit, replacement, that will take you 20 minutes after 2 weeks. And then the third visit, if you finish the treatment, then that will take you 10 minutes. But if it needs a replacement, then that will take you roughly 20 minutes. And what I wanted to tell you, because that is in my own experience, my recommendation is to treat protruding ears 6 weeks and to fixate them with a retractor for 3 months. Because protruding ears, they tend, if they come to you and then you start treatment and then after 2 weeks it looks perfect and you think, maybe I can stop. And also if the parents, they want to stop sometimes because it's not nice to have a baby with 2 EarWells. But my experience is if you stop too early, then the child can still grow into the deformity. So it's, especially with protruding ears, is very important to fixate them a bit longer to keep them in shape. And then they will be perfect for the rest of their lives. There are some complications with EarWell, of course. They are very rare, but it can happen. There can be a skin rash, which you can see on the left. I've seen it once. I've seen it in a kid that was a bit older than 6 weeks. Before 6 weeks, you almost never see it. There's also in literature, it's described that it's very rare. But after 6 weeks, the immune system of the baby is a bit more developed, and then you can see a skin rash. I would not recommend to replace the system. This is a skin reaction that the baby cannot handle the system. So then you have to stop treatment, or maybe you can just place a retractor. That's what I did. I placed a retractor to prevent the ear from protruding a bit more. Another thing that you can see is a pressure sore because of a bit more pressure on one point of the ear. You can get a small abrasion, and this is mostly not a huge problem. You just remove a retractor for 2 days and then the abrasion will heal and the treatment can be continued. And there can be some redness of the skin, as I showed in the pictures earlier. After removal of the system, it can be a bit red, and sometimes it can also be a bit smelly. That doesn't matter for the baby. You just clean everything up and that's it. There can also be some early loosening of the system, mostly after when it comes to the 2 weeks, then the system can get a bit loose. Just tell the parents that they have to call the clinic if it happens. Most of the time they can just send a picture and you fixate it a little bit more, or they fixate it themselves. And also if they don't want to do it themselves, your assistant at the clinic can do it. What's very important is what in my experience is you have to instruct the parents. When I just started EarWell, they all had my private number. I would never recommend it, but because they called me in weekends and in evenings that something might be wrong. And to be honest, I never had something seriously wrong, but it's just parents that are yeah, a bit nervous about what's happening to their baby. So you need to instruct them very well. And the system must stay dry. That's very important. So if milk or spit comes into the system, they have to call and you have to clean it. But most parents keep the system very dry. So and they are very careful with the system. You have to instruct them in the development of some retinence or a pressure sore that they have to stay calm. Just call the clinic, your assistant, and it's easily solved with removing a retractor. Babies can sleep on it, there is no pain, and you have to be a bit careful with dressing up. And most parents use the tummy top to bathe their baby because the head sticks out and it doesn't get wet. So in conclusion, EarWell is natural. There is no surgery needed. It's very important to start treatment early, before 3 to 6 weeks. You can start in literature until 12 weeks, but you have to instruct the parents very well because after 8 weeks, if you look at the literature, the success rate goes down to around 50%. So in the beginning, the success rate is around 95%, but if you start after 8 weeks, then the success rate goes down. Some parents still want to start, despite the costs and the fact that the success rate might be lower, and it can work. The oldest baby I treated was 12 weeks and it worked, but you have to instruct the parents very well, and the parents have to be very motivated because the treatment will take a bit longer. Normally, the treatment duration is 4 to 6 weeks and there are no significant risks. So in conclusion, with EarWell, you can create beautiful ears without surgery, and we all together create a lot of happy kids. Are there any questions?
Hi, Michelle. Can I ask a question?
Yeah, of course.
First of all, thank you for the beautiful presentation. You're talking about duration of treatment of 4 to 6 weeks. Is that dependent on the indication of treatment, or is that dependent on how well the result looks after 4 weeks?
Yeah, it's dependent on when you start treatment. So if you start before 3 weeks and it's it's lidding, for example, then the shape can be good after 2 weeks and then you are able to stop. If you start, but with, for example, protruding ears, then you have to treat a little bit longer, because also when the shape is good, the child can still grow into the deformity. So it's dependent on the time, so when you start, and it's dependent on the deformity you treat. I hope that answers your question a bit.
Michelle?
Yeah.
What I didn't understand was when you have protruding ears, you said you can treat it after with 3 months with the cradle. You mean the too big stuff, or
No.
you don't need the smaller stuff anymore?
You use the cradle. So as I showed you in the video, then you use the cradle. Maybe wait, I stop sharing the screen. Maybe I can look at all of you. That might be easier. Yeah, it's better. Maybe better to talk like that. So what you do is you place the cradle for 4 to 6 weeks with protruding ears.
Yeah.
Probably 6 weeks, and then after that you just fixate it. But there's a video on EarWell's MD as well, but you fixate it above with a retractor and some tape. But there's, if you on EarWell's MD, there's a video as well on ears and how to fixate it. So you just watch the video and it's very easy, and the parents can do it themselves. So you stop the treatment, you stop the EarWell, and you instruct the parents to how to fixate the ear. because that is very important to prevent the deformity from growing back.
Okay. Yeah, thank you.
Michelle, can you see on your question and answers? There are people who are asking on your questions and answers some questions.
Can you use it in order children, assuming the parents understand that it, in order? Can you use it in order? I don't really understand this question. Maybe Barbara, she typed this question. Can you use it order in maybe you mean in children older than age 5 weeks, you mean? Yeah. So Barbara, you mean older than 5 weeks? Parents understand that made right. The mold fits around, yeah, if your question is the mold fits around bigger ears, yes, but the mold fixed until, it depends on the ears, but until 12 weeks, it will fix on the ears. But I would recommend to start, yeah, if you are starting EarWell, to not start after 6 weeks. If you have a parent that is very that insists on starting after 6 weeks, then you have to inform them very well that there is a chance that the treatment will not work. And yeah, they have to pay for the treatment. So you need to inform them very well that there might be a chance that of 50% that the treatment is not successful.
Ja, het is omdat ik een kind heb waarvan dat de ouders geen operatie willen laten doen en het wel een kans willen geven met EarWell, maar het kindje is al 5 jaar oud, vandaar mijn vraag.
5 jaar?
Ja, 5 jaar.
Oh, ja, sorry, dat snapte ik niet. Nee, dat kan niet. Nee, dat is echt onmogelijk. Nee.
Het gaat ook niet passen rond het oor, zelfs niet als ze bereid zijn, nee.
Nee, dat heeft echt helemaal geen zin. Dat is echt zinloos.
Ja, oké.
12 weken zou nog kunnen, hè? Ik heb het ook geprobeerd, maar nee, niet 5 jaar.
En waarom niet? Waarom... Wat kraken al te hard is?
Ja, zeg maar, het is vormbaar, omdat in de eerste 6 weken circuleert er heel veel oestrogenen van de moeder in het bloed van de baby. En daardoor is dat kraakbeen nog vormbaar. Na 6 weken neemt dat af. Maar goed, als kindjes bijvoorbeeld te vroeg geboren zijn, kan je weer wat langer doorbehandelen. Dus ja, de maximale waarop je zou kunnen starten met goede instructie is 12 weken.
Ah ja, oké. En als je spreekt van een retractor achteraf, bedoel je dan een haarband of wat bedoel je dan?
Nee, een retractor is eigenlijk gewoon, ja, dat zit in het systeem. Hè? Dus dat is natuurlijk een van die vormertjes, maar die plaats je dan eigenlijk zo op het oor. Maar jullie krijgen allemaal de wachtwoord van de EarWells en die website. En dan kan je al die filmpjes kijken en daar staat het gewoon op. Daar staat het ook heel duidelijk uitgelegd.
Ça va, dankjewel.
Oké. Ja. Goed. Are there any other questions?
What's the price you ask for the EarWell reconstruction?
So EarWell in general has a price for the parents, and it's the same everywhere. So what we do with EarWell is we select different plastic surgeons per region. So that means if you decide to do EarWell, then you get to do EarWell for your region. And the price for the parents is fixed. That means for 2 ears, it will cost the parents 1,500 euros. And for 1 ear, it will cost the parents 1,200 euros. As plastic surgeon or as clinic, you have to pay for the set. And the set will cost you 508 euros. And with 1 set, you can treat a bilateral deformity for 6 weeks. So that means if you have a unilateral deformity, then there is a possibility that if you have a unilateral deformity, you will have some leftovers from the set. From if you treat a baby on the right side, then you have the cradles on the left, you have left, and then you can use it on another baby. Is that okay?
Bart, maybe a question for you. Does this count as an aesthetic treatment? Or to put it more accurate, is the implant, is it, do people have to pay BTW? Do we have to pay BTW on it? Do we have to order it through the pharmacy of the hospital, or what are the practical points?
No, you can. The product you can buy. You can send a mail to Aljamed, and we will bring it to you. We will send it to you. It's not necessary to send it to the pharmacist. There is BTW TVA on it. I think it's 6%, but I will check that. And is there reimbursement in Belgium? We are doing everything to ask the reimbursement for EarWell in the next months. But you know, in Belgium it will take 6 months after we get if they accept it, that we will have a reimbursement. But I think that it's possible, because the reimbursement of the surgery is also you get also a reimbursement of the surgery for your ears when you are 6 or older, I think.
Yeah, in Holland it's not covered by insurance, and if it ever gets covered by insurance, it will take at least 5 years probably. So people just have to pay for it, but they can declare it with the tax service. They can, the medical costs that are not covered by insurance, you can declare it with the taxes. So that might be a bit of a, yeah. But to be honest, I've the costs are not super expensive, and all the parents who've done it, they were all very satisfied, very helpful, very happy that EarWell was there, and they are willing to write reviews. So I never had someone that said it's way too expensive. Okay, are there any more questions?
Yes, Michelle, do you see on the question from Dr. Schuckman?
Oh, wait. Oh, there. No, I cannot see it.
He asked you if the babies have a lot of comfort with bringing it on.
Do the baby, what's the, I think that's for Marjoes, but I cannot read the questions.
Michelle, ik vroeg me af of de baby's veel last hebben. Of do they have a lot of trouble when you bring the system on? Do they have pain, or do they cry, or?
No, sometimes with removal of the system, but there's in the system there is adhesive removal, gaasje, zeg maar, and you can use it, and then it will dissolve the adhesive a little bit. But with putting the system on, they mostly just sleep. The babies don't feel it at all. And you can use like een tutje, I don't know, a pacifier to soothe the baby, and that will help. And sometimes what I also did is some mothers did breastfeeding, and they breastfed during the application of EarWell. That also worked fine.
Okay, that's a good tip.
Ja, dus de baby heeft er helemaal geen last van. Doesn't bother the baby at all.
Okay, thank you.
Are there any other questions?
Yeah, Michelle, how much recurrence do you have, and what is the time of recurrence if you see it?
Yeah, with the only recurrence I've seen is with protruding ears, and that's that is why I told you that you have to fixate it, because it's very important. But all the other deformities, they just stay away. Yeah. But
also in your training in New York, you didn't saw any recurrence, zero.
No, I haven't seen, but I haven't been there so long. But the EarWells I've done so far, I have with all the other deformities, behalve, despite protruding ears, I haven't seen a recurrence. No, but
and
I will.
How much EarWells did you do?
Around 40 to 50.
Okay.
Yeah. So, but with protruding ears, I had a general practitioner, and we started treatment, and she was a bit doubtful. And then after 2 weeks, the ears were shaped perfectly. Then I said, okay, we can place a retractor and then stop, and then it came back, and then that was a problem. So that is why it's so important to fixate the protruding ears a little bit longer. Yeah.
Okay.
Michelle, one more time. You already told us, but I forgot the success rate before starting before 6 weeks is 95%, or was it before 3 weeks?
No, yeah, before 3 weeks is 95%, and before 6 weeks is around 80 to 90%.
Okay, thanks.
Yeah, and I thought maybe you would have a question about ear bodies, because that's obviously the competition of EarWell. So I prepared one slide because if you start EarWell, then you might get a question from parents: why do you do EarWell and why don't you do ear buddies? So because we wrote a review on ear molding in infants with all the recent literature from 2010 till 2020, there were 16 articles. I will just show you that slide because that might be also a question you get from parents if you start, or a question from other plastic surgeons. And this is the review, the studies in the review, and there were 16 studies. There were 8 EarWell studies and 1 ear buddies. So EarWell is the most complete system, but also the most research system. So that is very important. And you can treat also conchoid cross with EarWell that cannot be treated with ear buddies, and the success rate is different. So ear buddies, there's a Dutch study with ear buddies, that's the only one, and it has a 65 success rate, and EarWell it's around 90-95%. In deformations and malformations, of course, it's lower, it's around 65%. But that's a question you might get from, if you start EarWell, from or other plastic surgeons, or from parents. But yeah, the reason why I chose EarWell is that because of the extensive research and because of the good results, of course.
Yeah, I told you, Michelle, that I ordered EarWell for my youngest daughter because I didn't, not EarWell, ear buddies. Yeah, because I did not know about the EarWell, and I also found the cradle quite large, and I thought, okay, I'm of course a plastic surgeon looking at the ears of my daughter, and my husband said, please don't start anything, they're gorgeous already. But I saw something and I wanted to treat it. It was a little helical rim deformity. And I started the ear buddies, and I found them compared to, I think, the EarWell, which I have not used yet, but I think the EarWell is might also be better because you really protect the ear. So I did it only for that helical rim. I did not stuck the ear with tape to the head. I only used it as a kind of silicone spacer or tube, I don't know how you want to call it, but that's I found it not easy to handle, because when laying on the ear it was harder to keep it in shape. So I think that's also a big advantage of a cradle, to protect the construct you made.
Yeah, and it's what's also a very big advantage is it presses the conchoid ball down, and you need that downward pressure, especially in protruding ears and in conchoid cross and all that kind of.
Yeah, and all those deformities cannot be treated with ear buddies.
No. So that is why. That's the reason why I chose EarWell. You choose EarWell as well, and that is also what you can explain to the parents. It's a bit more expensive, but it works a bit a lot better. So that's why.
Yeah.
Okay. Are there any more questions? Wacht. Misschien in de Q&A. Okay. Good. Bart, I don't know if you want to conclude anything.
No, the only thing I want to say is, first of all, I want to send to everyone a mail with the so that you can see again the website, so that you can see again the video, but you need a password, so I will put also the password in it. And then I think I want to thank Michelle for a presentation and for the good advice. Thank you well, Michelle.
Yeah, thank you. I want to thank everybody that is here, and I hope that you guys are just as enthusiastic about EarWell as I am. And but you will be when you start treating the babies and see the results. Okay.
Bye-bye.
Bye-bye.
Okay.
Thank you.
Dankjewel, Michelle.
Graag gedaan. En succes.